So let's start with Michelle Munro-Kramer. She will speak about her hackathon with student nurses at the University of Michigan. Students have amazing ideas and in this session, you learn about how they learn to design and execute those ideas. So thank you. Michelle?
Thank you, Nancy. Good afternoon, everybody. I am so excited to be sharing my journey through the Johnson & Johnson Nurse Innovation Fellowship with you. As Nancy said, I will be focusing on the development of nursing student innovation ambassadors. My current role at the University of Michigan School of Nursing is as an assistant professor and director of global programs. And so I'm building off that work to work with these students. So to get started, I want you to imagine entering a leading school of nursing as an undergraduate student with the goal of reducing waste and improving recycling and reuse in the healthcare environment. As a high school volunteer in a hospital, you saw the large volumes of waste created during healthcare exams and procedures. And now as a new nursing student, you continue to see waste produced in your simulation training. You join the honors program with the goal of undertaking this important work, and soon find that there is no program, curriculum, or opportunity for you to innovate, create, and test new ways to reuse and recycle. This was actually the experience of one of our undergraduate nursing students years ago. After meeting with this student and seeing her disappointment, I too became baffled by our failure to create opportunities for students to learn about and develop their innovation skills. I found that innovation programs for faculty are starting to pop up at schools of nursing across the country. However, there has been very little focus on nursing students as a driving innovation force. Yet the future of healthcare requires creativity, interdisciplinary collaboration, and energy from our emerging healthcare leaders. In order to address this gap, at the University of Michigan School of Nursing, we recruited a cadre of student innovation ambassadors. So these are nursing students that were lured by the desire to think outside the box. We recognize that our nursing students have been called upon by other disciplines to share their perspectives related to healthcare innovations because of their clinical experience and the close relationships that they develop with patients, families, and communities. As students, they often have the ability to recognize problems and visualize solutions that healthcare staff entrenched in the system may not be able to see. However, they have rarely been the ones to lead innovations, product development, or the creation of new businesses. The Student Innovation Ambassador Group was developed in the winter of 2019, and they spent their first year together developing the following priorities to guide their work. So they wanted to have an increased awareness of nursing and innovation amongst their peers at the university and in the community. They wanted education about innovation infused in the curricular and extracurricular opportunities. They wanted the honors program to expand beyond a focus on research to include innovation and leadership. And they wanted mentorship from interdisciplinary teams representing nurses across levels and employment opportunities. They wanted to learn more about leadership, policy, owning a business, as well as working in the clinical environment. The students decided to conduct a school-wide nursing student survey to measure baseline student experiences with innovation and to understand what students wanted in the future. They received 319 responses from across levels, so from freshmen to graduate students, that illustrated the following. 85% of nursing student participants believed they would be very good, good, or somewhat good at coming up with creative solutions. But 86% of those students were also not confident or only somewhat confident that they could actually disseminate their creative ideas. Furthermore, 83% of the nursing student participants believed innovation-related content should be incorporated into their student experience. So to me, this data demonstrated that nursing students believe they have creative and innovative ideas, but do not necessarily have the training or confidence to move those ideas forward. Based on this data, the student innovation ambassadors also wanted to host an event at the School of Nursing to highlight the knowledge, creativity, and skill of our student nurses in recognizing and solving healthcare problems, while also learning to work with other disciplines as healthcare leaders. So this led to the launch of an exciting event called the Innovate for Change Hackathon that just took place this fall, in the fall of 2021. We had interdisciplinary teams representing all levels of students. So again, freshmen to graduate students. They worked together with coaches from the University of Ann Arbor and Flint for 5 weeks. During this time frame, they identified healthcare problems, brainstormed solutions, researched alternatives, and eventually developed their own idea on how to solve those problems. They presented those ideas to a panel of 5 judges and a virtual and in-person audience of peers, donors, and supporters. Due to the COVID-19 pandemic, this event included both in-person and virtual components. So they were able to have the kickoff event and pitch in person, while much of the work in between, when they were working with groups and engaging in different educational opportunities, occurred virtually. For nearly 70% of the student participants, this hackathon was a new experience they had not previously engaged in. In total, 7 teams ranging in size from 2 to 7 participants engaged in the event, and they represented numerous disciplines, including nursing, public health, engineering, dentistry, information science, data science, health informatics, and business. The important thing was that this was a nursing student-led event, and that each team had a nursing student on it. In the end, these teams had 5 to 7 minutes to present a compelling case for their idea that covered such topics as vaccine verification, supporting new mothers, addressing postpartum hemorrhage, and recycling healthcare waste. In the end, 5 teams were awarded financial support totaling over $7,000, and they received ongoing mentorship from our Healthcare Innovation Impact Program to continue to move their ideas forward. One of those teams that is moving their idea forward is Team Mother Nurture. So they've made the most progress in the last couple of months since the hackathon ended. Their innovation focuses on using nursing students to provide supplies and education to at-risk new mothers and their babies in Flint, Michigan. You may have heard of Flint, Michigan in the news. The city has been plagued with high rates of unemployment, crime, and most recently lead in the water system. According to statistics from 2019, the infant mortality rate in Flint was 10.8 per 1,000 live births. That's compared to a state average in Michigan of 6.4. Additionally, over 85% of the births in Flint were covered by Medicaid. So what these 2 nursing innovators did is they developed a program with the local hospital, Hurley Hospital, as well as the University of Michigan Flint School of Nursing, and they are now creating boxes with essential supplies for these women and their newborns that are delivered by a nursing student. The women get the education, they get the supplies before they leave the hospital, and the students get the education and clinical hours for providing this service. It's a win-win for both groups. My work with student innovators has been both humbling and exciting. It has truly been an honor to help guide these students in their innovation work, and I cannot wait to see what they do in the future. I am confident in our next generation of nurses, and I want to continue to provide them opportunities to think outside the box. My personal next steps to help propel this growth forward are to publish and present with our students. We are currently writing an abstract for our local research day, where students will present on the development and execution of the nursing student-led hackathon. This will increase awareness in our school as well as among colleagues in other schools. We're also working on a publication to more broadly disseminate our work developing the Nursing Student Hackathon. We plan to continue the Innovate for Change hackathon with increased opportunities for learning. Since we're in an academic environment, students want to learn more. They've asked for more educational sessions on intellectual property, business models, and design thinking that we plan to incorporate in the future. And then I think we can continue to increase options for innovation in our curriculum. I teach a course on gender-based violence, which includes an experiential learning opportunity, where nursing students generally volunteer with a community group. Next year, they will be collaborating with business and communication students from Colombia and Mexico to create a social media campaign about gender-based violence. We need to continue to think creatively about how to involve students in innovative ways to promote health. I hope that these future events continue to promote the role that nurses have in healthcare innovation, and especially the role our nursing students have in revolutionizing healthcare. That ends my presentation. I do want to say a quick thank you. This has been an extraordinary fellowship, and I do want to thank our student innovation ambassadors at the School of Nursing. I think some of them were able to join, and they definitely made this project possible. Our administration in prioritizing nursing innovation, Nurse Approved, particularly Nancy Hannaran for the mentorship, Johnson & Johnson and the Center for Creative Leadership for developing this fellowship, and of course to all my amazing fellows that you'll get the opportunity to hear from.
Well, thank you, Michelle. That was just really terrific. I'm so happy to hear that the students got that kind of direct attention from you. There's one question that came forward. How are you creating psychological safety, particularly in a situation with significant power differentials like in academia, where students and those newest in their careers feel safe and prized for bringing forward a problem they're bothered by and would like help solving?
Yeah, I think that's an excellent question. I guess the first way is that the Nursing Student Innovation Ambassador is a student-led group. So they created the priorities and they really drive what we're doing. I am there as more of a guide and support. So I think that has helped. During the hackathon, our participants had a direct link to the students. They did not have to reach out to a faculty member, and many of them did reach out directly to our students with questions. The other piece is we did prioritize our hackathon on students. So there were no faculty, there were no staff, there were no healthcare providers involved. Part of that was related to intellectual property and the way that's handled at our university. But the other part of that was really to let the students lead the way and not necessarily have the kind of interference or the power dynamic that might have been present if a faculty member or a staff member had potentially been involved on their team.
Yeah, I remember when you were planning this, how carefully you thought through that power differential and how it would play itself out in this situation. And you wanted those students to feel like they had a full voice in this event. So do you feel like you really were successful with that?
I do. I mean, I think there's always, like administrative issues that aren't easy to handle as a student. But I mean, they own this event. They recruited for it. They planned for it. They're planning for the future. I definitely feel that we were successful in really allowing the students to own and create the event, which was truly what was needed for them as well.
Yeah. Another question that's very interesting that came forward was about the response on the part of your fellow academicians. Did you feel that there was any kind of, seeing this as a fad rather than anything that's valuable to move forward with?
No, so we reached out to a number of different faculty to help support this event in different ways, as coaches, as judges. And I think that the faculty were very willing to jump on board and help support students. I think they were sometimes worried about their role and what they'd be able to provide. And so they, as researchers were maybe thinking more about kind of data collection and weren't sure what they could provide in a 5-week event. But really saw that they were a sounding board for students and that they could provide feedback based on their clinical experiences or their experience in leadership and policy. They were excited by the ability to have an event like this for our students. And it was really exciting to bring in some of our neighboring universities. So University of Michigan Flint is kind of a sister school. They are in a different community. They face different healthcare challenges. And so we had faculty from both schools. And I think overall, they saw it as a really positive thing and have asked about the future of the event. So didn't necessarily see it as this fad or one-time event.
Yeah, that's great. So how do you see these nursing students in particular taking this into their practice as they graduate and move on into the healthcare world?
That's a great question, and obviously it's going to depend on each individual. One of the students decided to pursue a minor in business as well, and she's very interested in developing a company. Others, I think that, many of them are working as nursing assistants on units, and it's really helped them to kind of question problems. And instead of just saying, we do it this way because we've always done it this way, they've started thinking about solutions. So I see them doing that in their roles now. And I do hope they carry that with them into whatever their next job is.
Well, the research by Anita Tucker shows that about 33% of nurses' time when they're in practice is spent fixing problems. So, it seems like what you are proposing is getting them ready for that particular activity. And perhaps some of the reasons why nurses don't like to feel inadequate when they get out there and start working is that they don't have those skills, the knowledge base that they need to really engage fully. It's only after, time that they develop it.
Yeah, hopefully some practice and confidence as nursing students will help them feel, succeed in doing that in the future.
So there was another question that came forward about regarding the FAD question. Are there other problem-solving methodologies like Lean or Six Sigma used in the organization that could be seen as in competition to a hackathon format?
So not in our academic environment. I could see that happening in a healthcare system potentially. I think there are many different problem-solving methodologies, and even within our academic environment, it's taught in different ways depending on the discipline. I guess with the hackathon, we were using it as a more of a fun extracurricular event to give that confidence and that ability to practice. We are working on a stronger partnership with our health system. And so, I know earlier we heard from one of the other fellows about what they've done within a health system, but I think there's many opportunities for academia and health systems to collaborate. And there might be some exciting ways to think about different problem-solving methodologies and even how they differ, right, in academia versus in the formal healthcare system.
Yeah. Well, thank you very much, Michelle. Just really wonderful thoughts and a great program.